Hello, Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Bele from Faculty of Dentistry. So I'm gonna retell the article about Ortho-Perio Interrelationship Treatment Challenge. At first, the abstract tell about periodontal health is prerequisite for successful orthodontic therapy. A lot of complex problem of teeth have been done by doing multidisciplinary approach, and none of them could do better than an ortho and perio interaction. This paper was written to familiarize dentists, especially in the department of ortho and perio, about preventive action and clinical technique to take care the integrity of compromised periodontum. The next is intro, then tell about orthodontic is a treatment to solve a lot of oral problem in a very first place, not to give more sickness. Besides its treatment, the success of orthodontic treatment for patients who was periodontal compromised was depends to their periodontal health before, during, and after the treatment. Periodontal compromise could make more pathologic condition that could affect to the teeth than that has relation to it. When it didn't done well, it could complicate the control of plaque itself. Besides that, it could affect the teeth aesthetic and the function of our teeth. It also needs the consideration of the patient itself to take care of their oral hygiene and how the clinical could handle it with nice tool and method, so it can be called a success treatment in the end of the day. This article was done to review the benefit in integrating ortho and perio treatment to manage patients with periodontal compromise. In the article, tell the treating periodontally compromised patient. Before commencing orthodontic treatment, it is mandatory to assess the status of the periodontum. Periodontal screening and recording is highly sensitive in detecting deviation from periodontal health. And the next, generalized screening, any two options, OPG or IOPA. OPG serve an excellent tool for generalized screening. However, the bite-wing radiograph is the best diagnosis tool for evaluating periodontal osseous lesion, as it allows better crystal bone evaluation. And our IOPA may also serve as a viable option for interproximal bone level assessment. It's also any laboratory test to check if there is a high-risk site in the patient. How? Any 2 points. A lot of casualty factors include culture, DNA probes, ELISA, and BANA. B. The clinical will test their patient by using a lot of factors I've mentioned before and will get the proper result. And they could take a decision how to treat their patient while knowing if their patient has a high-risk site. Example, patient who run a high risk of developing site with additional attachment loss include those with multiple residual probing tips greater than or equal to 6 mm and landing on probing at 3 months re-evaluation after periodontal therapy. Next, any ortho-perio treatment, comprehensive assessment and occlusal adjustment are mandatory as occlusal interference promote dental jiggling, aggravate attachment loss, bone loss, and significantly decrease potential reattachment after periodontal treatment. Periodontal osseous defect like osseous crater, their tree-wall defect, and furcation defect need to be treated before beginning orthodontic treatment. Osseous craters should be treated pre-orthodontically, as treatment increases the ability to maintain interproximal arch during orthodontic treatment. And because they do not improve with orthodontic treatment, shallow craters must 4 mm to 5 mm pocket may be maintained non-surgically. Orthodontic therapy can be initiated only if the periodontum remains stable over the next 3 to 6 months after periodontal therapy. And the next, any precaution during orthodontic treatment. During orthodontic treatment, oral hygiene instruction should be reinforced and professional tooth cleaning should be done every 3 months. Periodontal re-examination at every 6 to 12 month interval should include recording of probing depth, blending of probing suppression, gingival recession, and bone level assessment through radiograph depending upon the situation. Orthodontic applicants and mechanics should be kept as simple as possible as they have a tendency to accumulate plaque. Bone level must be used as a guide to position break in patients with advanced horizontal bone loss. Lighter orthodontic force should be applied, as greater orthodontic force can further weaken the periodontum. Orthodontic decrowding in the anterior region will improve the embrasure forms and maintain healthy and aesthetic papilla. There are also any periodontal procedure after orthodontic treatment. Following orthodontic treatment, the patient should remain on 3-month periodontal maintenance program and should be reassessed to evaluate for the periodontal need. A gingival grafting procedure may be considered after orthodontic treatment in case where it has to be performed for cosmetic reason and also for area of borderline attachment gingiva that have been eroded during orthodontic treatment. The patient should be re-instructed about oral hygiene measure following appliance removal in order to prevent labial gingival recession, which may occur as the result of overzealous brushing as the cleaning becomes easier after decrowding. Any beneficial effect of orthodontic therapy on periodontum. The benefit of orthodontic treatment for establishment of a stable periodontal status in case of loss of periodontal support have been confirmed in large-scale studies regardless of the applied orthodontic technique. A. Improve oral hygiene. B. Prevent damage to periodontum. C. Help achieve favorable crown-root ratio. D. Improve compromised periodontal condition provided oral hygiene and maintained and tissue are healthy. E. Facilitate improvement of gingival architecture et al. And the next, any possible adverse effect of orthodontic procedure. Orthodontic force can cause angular bony defect and attachment loss, especially with tipping and intruding movement. Gingivitis and gingival enlargement is observed soon after placement of a fixed appliance. Increase in salivary bacterial count is seen after orthodontic band placement, may result in root resorption, pulp disorder, et al. At the end, the conclusion the article is orthodontic treatment is no longer contraindication in the periodontally compromised patient. the maintenance of healthy periodontal tissues through active orthodontic treatment is of paramount importance to ensure a healthy periodontum. A successful orthodontic outcome can thus be achieved with an integrated Ortho-Perio approach. So that's it. What can I say? From retelling this article, I'm sorry if I have a wrong word or wrong pronunciation. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.